come in.
Hi, Jen, is that
Yes.
we go by?
Yeah.
I'm Danielle, I'm the nurse practitioner, student. I am coming in to do an assessment, sounds like you're not feeling too good.
Yeah.
Okay, can you tell me a little bit about that?
I've just had like
Wash my hands.
this congestion and cough for a while now.
Okay,
Yeah, and then sometimes I feel like I can feel my heartbeat. It's like pounding. in there.
okay. Is that new? That feeling like you can feel your heartbeat?
Yeah, like
Okay.
yeah, like the last week or so maybe. Yeah.
Okay, are you, so the chest congestion and that started about a week ago?
I think like 2 weeks ago.
Okay.
Yeah.
Yeah, I saw that your blood pressure was a little elevated, 149 over, I believe it was, I have to look over here in my papers.
Mhm.
149 over 92.
Mhm.
But your heart rate looks within range in the 80s. That looks appropriate to me. Do you have a history of any hypertension? It looks like the last couple of blood pressures we got from you in clinic, you've been a little on the hypertensive side.
Mhm. Yeah, but they gave me stuff for that.
Okay, do you remember what you're taking for that?
Yeah. Lisinopril, I think it's called. Yep.
You taking that daily?
Every day.
Okay. How have you been treating your chest congestion? Have you been taking anything at home for your
Yeah, I got some
symptoms?
stuff at Walgreens.
Okay, do you remember what it is?
I think it's like Robitussin or Dayquil or
Okay.
something like that.
Okay.
Yeah.
And how often are you taking that?
Whenever I feel cruddy, a
Okay.
few times a day, I suppose.
Okay.
3 times.
Are you
Sometimes 4 times.
taking the recommended dose, or are you taking more or less?
Oh, I swig out of the bottle.
Oh, okay.
Yeah.
Okay.
So it's probably like a couple capfuls a time.
And does it help?
Yeah, it works
Okay.
for a bit. Yeah.
Okay. And do you notice while you're taking that, when you're taking those doses, are you noticing any change in your heart rate after, or how you feel afterwards, other than resolving the symptoms?
Well, my cough gets better.
Okay.
Yeah, but I still have that palpitation, like that I can feel it beating. I feel that heartbeat
Okay.
sometimes.
Okay, if you're okay with it, I'd like to do a little bit of a physical assessment. I would like to listen to your heart, your lungs, take a pulse, and just check those things out.
Okay.
Start with that. Is that okay with you?
Yeah.
Okay, I'm gonna wash my hands, and I'm gonna start with just listening. I'm gonna
Okay.
listen to your heart sounds here with my stethoscope. Okay, and now I wanna listen to some lung sounds. I'm gonna listen to the front first, and then we'll listen to the back.
Okay.
Okay.
Should I lean forward?
Yep, I'm gonna have you lean forward. Is that comfortable for you?
Yeah, that's
Okay. I'm gonna have you take a deep breath in. Every time you feel me move my stethoscope to a new spot, take a deep breath, okay?
Mhm.
So start here. 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 One more spot here. Okay. All right, you can lay back. I'm just gonna feel your pulse. Okay, so what I'm thinking is a couple of things, and wash my hands. I think we should get a chest x-ray and an EKG, which is look a little picture of your heart to see kind of the rhythm, how it's functioning. Those palpitations are a little concerning to me. I wanna see what we're doing that way. The chest x-ray I wanna look at to sort of rule out the potential to have pneumonia. You sound a little like there's some congestion, I can hear it. Lung sounds are a little, I hear a little bit of slight crackling in there that I'm not liking, so that indicates to me there might be some fluid in there that I wanna look at. Also, I think we should get a CBC. I'm worried that, check your white blood cell count, see if there's anything infectious happening. I'm worried that, the cough syrup that you're taking might be, exacerbating your blood pressure and kind of canceling out the action of your lisinopril, making you have that higher elevated blood pressure despite taking it every day, and then having that, uptick in heart palpitation. I think that might be contributing to. Also, depending on which one you're taking, if you're taking like a Dayquil or a NyQuil, that has acetaminophen, Tylenol in it, so you could be having a fever, but we might not see it even in your vital signs right now because it has that Tylenol, so it's an antipyretic to keep that temperature down, so it might be giving us a false normal. So I wanna look at that. And has anybody ever educated you, with regard to your hypertension in terms of taking blood pressure friendly cough syrups?
No.
So, we'll get you some information on that. That's something to consider when you have hypertension, you're on a antihypertensive agent. You wanna avoid certain cough syrups that can make your blood pressure go up and also counteract the medication that you're taking. So there's a couple different ones. Cortisone and HP is one that's popular for people who have hypertension to kind of help so that you can treat your cold symptoms without interfering with your blood pressure regimen.
Oh,
Okay.
Okay.
So I'm thinking that's what the plan will be.
So I shouldn't, like,
Yes, I think the other thing too, if you are gonna take your cough syrup, you should use the measuring device that's there and take it by the directions that are on the bottle so that you're not overtaking the medication as well. That's can be dangerous too. Okay.
yeah.
So once I get the results back from those different tests, that'll tell us where to go next in terms of treating the palpitation and determining if that's the cause or if it's something else. And then if it comes back that you do have in fact pneumonia, we will have to put you on some antibiotics, so you'll take those at home.
Okay.
Okay? Other questions for me?
No, I guess we'll just have to see what these tests kind of show. And
Yeah, so once I have some of that stuff back, we'll have another discussion and kind of make a plan about what next steps will be.
Okay.
All right.
Sounds good.
Okay, thank you.
Mm-hmm.